So this is looking at the compressive force going through an ankle joint. And so yeah, to recap, before we went off on a bit of a tangent on the board, here we have our normal ankle. And so when you have a healthy patient walking in a motion analysis lab, and within the floor is, in essence, a secret panel that is measuring their force, when they heel strike, you can see that you can get up to a significant proportion of or over body weight. Where you have patients that are in need of surgery, and it's not clear from this quite how close to surgery or how in need they are, but you see that the peak force reduces, and indeed, post-operatively, the line and dot, you can see that that is below the normal as well. And so you can use the principles of gait analysis to measure the relative ability to walk effectively. And this is an accurate, standardized way, because you can plot it to body weight. And you can use that as a method of tracking how well someone is progressing after surgery. There are also other types of loading that we would consider. That is the shear force going through the foot. So effectively, the foot sliding backwards and forwards. One of the interesting points, and kind of coming on to the topic of conversation at the break there about the biomechanics of people in sport. At 40 strides per minute, the black solid line is what you see in terms of body weight going through the ankle. At 60 strides per minute, so getting faster in terms of approaching a run, then we see that there is a different distribution of those forces going through the ankle. So it's this kind of knowledge that is useful in terms of developing programs for mitigating injury. So here's our fibula. Behind it is the tibia. There's our talus. And then our calcaneal bone with the Achilles tendon that runs in and attaches. Probably that little bit of tissue there was where the Achilles tendon attaches in. And it attaches across a fairly significant length, probably finishing about there. Underneath the foot, we have a tendon or ligament-like structure, which effectively creates an arch of the foot. And we're going to discuss the foot and the kinematics of the foot now. One of the common mistakes that people make when looking at the anatomy of the foot, and the hand is very similar, is to think that that is your toe. Because when you look at a picture, and certainly when undergraduate students are given this picture in an exam, the common error, depending on how you phrase the question, is to imply that that's your toe or that's your finger. The toes actually start from there upwards. And these bones here, you could feel in your toe, or indeed you can feel in your hand as well. And they are tied together by fibrous layers of tissue. We call them sheaths. It's a very robust sac-like structure that prevents them all from moving laterally. So you can't physically spread your hands out much wider than what it is in normal use. These have particularly complex names. So these are our phalanges. The big toe only has 2 phalanges, much like your thumb, whereas the rest of your toes have 3 bones within them. They are tied onto the metatarsals. And then here are the bones of your ankle joint, the tarsals. The reason life gets a little bit complicated is because you end up then with some fairly complex names. And so where you have a joint between a tarsal and a metatarsal, you have the tarsometatarsal joint. Where you have an interface between a metatarsal and a phalange, you have the metatarsal phalangeal joint. So that's those 5 joints there. You then have an interphalangeal joint, which is a joint between 2 phalanges. And in the 2nd, 3rd, 4th, and little toe, you have 2 interphalangeal joints. You have one there, and you have one there. This one is further away from the center of the body, so we call this the distal interphalangeal joint. This one is nearer, we call that the proximal interphalangeal joint. So you've got phalanges, metatarsals, and tarsals at the bottom. And they all have these rather long, although to a certain extent logical names that describe them. And in the foot and about the ankle, we can move our foot within 3 planes. So motion around the ankle enables the foot to move in all 3 planes. So we can take our foot, twist it downwards to plantar flex, to twist it upwards to dorsiflex. We can twist it outwards to be adduction. We can twist it inwards to be adduction. We can invert it, and we can evert it as well. So dorsi and plantar, eversion, inversion, abduction, and adduction. So we can break down the gait cycle. So from heel strike to stance. So heel strike is when your heel hits the floor to stance. In our ankle, we see some eversion, pronation, and the forefoot flexes. So our foot actually bends. When we move from the stance to push off with our standing leg, then we see different characteristics. We see some external rotation, and the foot actually becomes a lot more stiff. So our forefoot flexes when we take load onto our leg, and as we push load off of our leg, it becomes stiff. And so mechanically, it acts as an efficient lever. And in terms of the strength of the various muscles, the soleus and gastrocnemius muscles are, in combination, the strongest in the body, and or one of the strongest in the body, and they pass force onto the Achilles tendon. And we know from yesterday that that is the largest and the strongest in the body, tying into the largest bone in the foot. But again, how does all this work? How do we carry such high loads going through the ankle joint? And we touched on this yesterday in terms of how do the joints lubricate each other. And we keep coming back to a synovial joint. We keep coming back to replacement joints. And the ankle is an area that is really being considered as a new and an upcoming opportunity for bioengineers. And it comes back to us trying to understand how these tissues interact with one another. And we remember yesterday that we've got these 2 layers, 2 smooth articular cartilage layers that have some fluid between them. And that fluid is synovial fluid. And we know that the synovial fluid and articular cartilage work together in this airtight capsule to provide very efficient loading, described by this graph. As a recap, here, the yellow trend is a mechanical engineering guide to lubrication of bearings. And so our parameters of interest are these parameters here at the bottom. We don't concern ourselves too much with viscosity when talking about the synovial joint, because within the rates, the shear rates we're talking about, the viscosity doesn't vary too much. And so we try and describe the healthy joint by using the two parameters, contact velocity and load. And so we're talking there about the velocity of the two surfaces sliding past one another. The load being the body weight, the joint reaction force going through the load. So going back to the use of vectors to calculate load, that's an input that we could have here with some use. And so if we don't consider load or ignore viscosity, if we merely consider velocity, then we can say our ankle joint or our knee joint or our hip joint, whatever one we want. These surfaces are over-representations of roughness, but the surfaces still, despite them being very smooth, have some element of rough asperities on them. And so if we take our contact velocity, if we have no velocity at all, we have a dry contact. The two surfaces are sat next to each other. If the joint moves relatively slowly, then we get some boundary lubrication. That is, that the surfaces rub past one another, but the surfaces have an element of lubrication because there's lubricant within it, and it's probably attached to the surface of the articular cartilage, and so this interaction isn't as bad as it could be, but it's not particularly enhanced by the lubricant. Indeed, you can continue to increase the velocity, and nothing really changes to the coefficient of friction. Until the velocity gets sufficiently quick that the lubricant starts to separate out the two contacting surfaces. And that continues to an optimal point, and essentially you want to be in this region here. And we said yesterday this yellow line is probably a little bit too steep. But this is the area of lubrication that's optimal, because you end up with clearance between the two surfaces. And so ideally, we want our natural joint and any joints that we subsequently design and want implanted to always operate within this region here. So we always want our velocity, our relative movement between the two surfaces to be relatively high, such that we can enter this region here. But the problem, of course, is that our joints always come to a stop. As soon as you reach flexion, full extension, or flexion, then your joint stops, and then it goes back the other way again. So as you walk, you heel strike, your joint stops, and then it starts moving again. And so whilst we desirably want to get up to a contact velocity that's quite fast, we always loop back to zero again. And so we want to get back into this region, then we loop back to zero. So irrespective of how we want our joints to behave, we need to be recognizing that there is a point when the joints come to zero. And so the challenge is, how do we get our replacement joints to this region as often as possible, despite the fact they always end up at zero again? And if we can understand how this happens, then it gives us hope in terms of designing implants for the future. But when you look at the speeds and the loads and plot it on this chart, then the synovial joint comes around here somewhere, which causes great problems, because if you look at boundary lubrication, then any bearing with boundary lubrication would never last as long as an articular cartilage surface does. The kind of lifespans that we're seeing means that it should lie in this region here. But the velocities and the loads just aren't, the relationship or the ratio between the velocity and the load just isn't high enough to fit within here. So it causes engineers and bioengineers some challenges. How do you describe what is happening within this joint, given that it doesn't follow any of the theories that are already established within tribology. And so if we consider boundary lubrication, so boundary lubrication is where there is direct contact between the two surfaces. Now, the synovial fluid that surrounds and bathes these joints, there's not a lot of it in the joint, but there's enough to have a covering of the surfaces. The chemical composition of the synovial fluid is such that it actually is attracted to stick to the articular cartilage surface. And so it could be that this chemical benefit of the human body enables shearing to take place within the fluid and not at the surfaces instead. And so that might be a reason or a justification as how it could be boundary lubrication that is happening and not fluid film lubrication. So fluid film is effectively these things here. So engineers and bioengineers are trying to say, this is the region that we sit in, and so it should be boundary lubrication, but we're getting where that's consistent with hydrodynamic or fluid film lubrication. So can they come up with some new theory that explains what's happening in the healthy joint? And so this concept of the fluid being stuck to the surfaces, chemically bound to the surfaces, is something that's previously been explored. Fluid film lubrication is something very different. That is that the relative movement of one surface to another actually enables a wedge of fluid to be developed, to be sucked into the joint. And if that happens quickly enough, then you can have your second component riding on a film of fluid relative to the first. And a common example of this, and I'm not sure how applicable or understandable it would be to yourselves here, but is if you were to aquaplane in the car. Now, an aquaplane is a circumstance where if you're driving at high speed on a flat road and there's a puddle of water, you can drive over the puddle of water and your car becomes out of control. And that puddle of water isn't especially deep, it's just a puddle. But the speed that your car is traveling means that you develop a wedge of water between your car tire and the road. And so you can inadvertently generate fluid film by going at high speeds. The likelihood of a car aquaplaning is far greater than the likelihood of a lorry aquaplaning, because a car is far lighter than a lorry. And so speed and load are important concepts in terms of, can you develop this wedge? If you drove over that same puddle at a far slower speed, then you're not going to slide, your car will not slide across it at all. You'll just get wet tires and you'll keep driving. And so that is boundary lubrication, because the lubricant, the water, has stuck to the tires, but you're still in control. The coefficient of friction in this instance is still high, and that's what you want. But here, if we drive along at high speed and we drive over some water, it's quite common, or not quite common, but it's certainly known to have happened where the car loses control and slides like it's on ice because the car is effectively on a layer of water in the puddle. If you're somewhere in between, then you might skid, because if you're on a wet road or drive through a puddle at reasonable speed and you slow down, you might skid. You might lose control. So there is an element of reduced friction, but not to the extent that you have no control over your vehicle at all. And so fluid film lubrication and boundary lubrication are quite common instances that we could be familiar with. However, an issue about developing this wedge of fluid is that the sliding velocity in the knee joint, in the hip joint, is just too slow. We have this theory that you need a relatively quick motion to generate the fluid, the film between the two, and that the size of or the speed of movement in the human body just isn't enough. And so we can't be generating traditional hydrodynamic lubrication. So that got engineers thinking again. Maybe it's the elastic component of the articular cartilage that's an issue. So maybe we are generating hydrodynamic lubrication, but the reason that we're generating this in a relatively slow environment is because our cartilage is elastic. And so maybe it's the deformation of the two surfaces that, despite it being relatively slow, the movement is enabling the generation of this layer. And this has been evolved further still to propose microelastic hydrodynamic lubrication. So perhaps it's the very small deformation of articular cartilage that's causing this superior lubrication process. And there have been studies in the mid-70s where people have been trying to understand quite how this works by using a bone covered with articular cartilage and sliding it against glass. If you were to lift the cartilage off the glass surface for a few seconds and then put it back down, you could reduce the friction. And so fundamentally, the surfaces are the same, but you could reduce the friction by taking the load off the cartilage and putting it back down again. So there's something in there that people don't totally understand as well. But what it did do is lead to 3 additional types of ideas: weeping, squeeze film, and boundary lubrication. So weeping, insofar as if you were to imagine a wound and fluid would weep out of a wound, that you would have almost this passive leakage of material or fluid back out of the cartilage again. Utilizing the fact that it is a porous material that does deform, can the synovial fluid move into it and then back out again? Is there a squeeze film? A totally different concept of lubrication. However, that cannot explain the joint lubrication under normal physiological conditions. And so, again, a new idea, a new proposal didn't really hold true. Boosted lubrication. Hyaluronate is the molecule within hyaluronic acid. So that's the lubricating element of synovial fluid. Is it that you can perhaps say that the articular cartilage filters the synovial fluid as it gets absorbed back into the articular cartilage, leaving the really greasy stuff on the surface? So there were pros and cons to that argument too. These are back in the 70s. So these are theories that have been explored and explored again. And people still don't have a good understanding fully as to what's happening. But as ever, people are trying to systematically characterize these proposals to try and ensure that scientifically, when we consider what's happening through the Gait cycle, we're making a systematic and scientific application of this knowledge. We know that in the Gait cycle during the swing phase, our joint loading is relatively low, our joint speed is relatively high, and so that would hold true perhaps that hydrodynamic lubrication is the lubrication method of choice. And then at heel strike, your joint loading is relatively high because you're taking a significant proportion of body weight, but your relative sliding speed is quite low. When you're in stance phase, you're in a moderate position. So maybe that's the elastro-hydrodynamic lubrication that's predominating. At toe off, so when we push off, we have a high joint load and a low joint speed. So maybe that's squeeze film. And so again, we see in the ankle joint as an emerging, exciting area of research, but applying these principles through the more traditional joints of the knee and the hip, we're trying to still build up a picture as to what's happening. How is this joint working as effectively as it is? Because if we can do that, then we can start to match our replacement designs with the natural surface. You might argue or question why somebody hasn't tried to have similar mechanical traits of a replacement joint. Why have they not had a hard underlying surface that represents bone, and then a softer cartilage surface on the top that would enable some of this filtering to happen? People have tried that two-phase replacement, and it didn't work. And so currently, we have this highly complex lubrication system happening, predominantly because of the highly complicated tissues that are involved. And yet, our best solutions are totally different. They are solid bodies of metal or plastic or ceramic that have no capability at all of encouraging any of these different lubrication mechanisms at all. We select materials that are as hard as possible and as smooth as possible so we can try and push as far to the right of that plot as we can. But yet we get 20 years and the human body about 70. Any questions on that? Nope. Thank you.